You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, and we've had him on the program before, he says nobody should be wearing a loose-fitting denture. With us we have Dr. Eli Jackson. Dr. Jackson, welcome back to the program.
Thank you. Glad to be back.
Now, every time you come in, you bring a stack of photos, so we're going to try to get to as many of those as possible.
I'd like to.
And these are like extreme smile makeovers.
Yes,
I'm not trying to side with you, by the way, but they do look good today. Now, for people that don't know your practice, like who's the typical dental implant patient that you see these days?
That is a great question. Typical patient probably falls into two categories.
Okay.
One category is people with teeth. One category is people that don't have teeth. For the people that do have teeth, they usually come in, they have bad teeth, broken teeth, cavities, bleeding gums. A lot of times their dentist has told them that they don't have enough bone to place implants. And so they're desperate, they're looking for a solution.
Do they feel like they're going to end up in a denture?
Yes.
Most of these people that come in?
Most of them that come in that's their biggest fear, that they're going to end up in a denture. And that's one of our best things that we can tell them is that, hey, you don't have to wear a denture anymore.
That's nice.
And so that's really good.
So one group is the people that still have teeth, but it's been determined those teeth have to come out.
Right.
Okay.
Correct.
And you give them new teeth, upper and lower, supported by dental implants.
Right.
Okay.
Upper and lower teeth that don't come out, and they're supported by dental implants. That's right.
Second group? Sorry for the interruption.
No, that's okay. Second group are people that don't have teeth, the denture wearers, okay? And many times they've been told that they don't have enough bone for implants.
But it is true. If you've been wearing a denture like 10, 20 years, you can't do this, right? You don't have enough bone.
No, that's not true anymore. Because a lot of times, if they don't have bone, a lot of times we can, we have different ways to grow bone. We can do different types of bone grafting. We use some special techniques that weren't available to us a few years ago. And so a lot of times we can have them out of dentures, if they come to see us. Because that's their biggest fear.
Now, is this true? Because you told me on the day of the procedure for the denture wearer, they walk in with no teeth.
Right.
Walk out with upper and lower teeth that don't come out.
That's right.
Is that right?
That's right. Yes, they're fixed in. They're upper and lower teeth that don't come out, and they're just supported by dental implants. You talk about people who've been in dentures for years and they have been told that they don't have enough bone, that they're too old. Well, we have several patients that have come to us in that exact situation, and every time we have been able to fix their teeth, give them dentures that don't come in, don't come out.
Like how many years?
That they've worn dentures, 20, 30, 40 years.
And you can still do it?
Yes.
Is that right?
And so it's just amazing because, and the biggest thing is, the reason they don't know about it is once they get those dentures, they usually don't go to the dentist much anymore. And so they aren't aware of what we can do today. They just don't know what's capable. And so, it's gratifying to us to be able to tell them that we can give them teeth that are fixed, that don't come in and that don't come out and are supported by dental implants.
What about how old you can be? Like, what's your oldest patient that had like a new upper and lower set of teeth?
Yeah. Well, age is really not a limit. My oldest patient that we've done this procedure on is 88 years old.
Really?
And she came to us. She knew she was going to lose her teeth. She didn't think she had any choice but to have a denture. And luckily, we were able to place these teeth that don't come in and don't come out on her. And she's just been thrilled. She thought she was going to be relegated to a denture for the rest of her life. She knew people that had dentures that couldn't eat, always had sore spots. She loved to travel. She loved to eat.
Okay.
She was afraid that she was not, going to enjoy, the rest of her life. And with this new set of teeth, it's kind of like her third set of teeth, really.
That's nice.
She's just been thrilled that she's been able to do all the things that she didn't think she was going to be able to once she lost her teeth.
Now tell me this, because look, you've been on an interview with me for quite some time, like 8 years.
Right.
Are the patients nowadays, today, are they getting older and older, or younger and younger, or a combination of both? They come in.
Yeah, that's a combination of both. I think people younger, they're able to have access to more information than maybe the older people were, because we do have a lot of older people that we see, 80, in their 80s. But the younger people, they get a lot of this information off the internet, so they find us. And so instead of suffering with bad teeth, bleeding gums, cavities, nickel and diming, spending a bunch of money at the dentist on dentistry that just isn't going to work, they'll go ahead and pull the trigger and go ahead and get this done, because they know they're going to have better health, they're not going to have bad breath, they're going to be able to eat what they want, they're going to enjoy life more, they're going to be more confident. So we're seeing more and more young people. When I say young, 40s, 30s, 40s.
Is that right?
Yeah. Well, they've just had bad teeth their whole life, and they're tired. They're tired of experiencing that. They have a fear of the dentist. They don't like to go, and because of that, they do. They have bad teeth. They have bleeding gums, things that just aren't healthy.
Yeah, but what about the bad gums, though? I mean, if you have gum disease, if your gums are bad, aren't those implants more likely to fall out?
Randy, once we get rid of the teeth that the bad gums are surrounding, we clear up the infection, and so therefore they can go ahead and get implants. So it's just a win-win. They're healthier. They no longer have bleeding gums, no gum disease, no bad teeth, and they have new teeth. So it's a win-win.
So 88-year-old, you did. I mean, I've heard stories where people are even older than that. Does that make you a little nervous when somebody's on that? And also, I guess statistically they're on like 3 or 4 medications. Can they do it if they're on medications?
Yes, they can. And I say that with a laugh just because so many of our patients are on multiple medications.
Blood thinners? Can you be on?
Oh, yeah, blood thinners. We work with their doctors, of course, and so that's, everything we do is with IV sedation, and that's real important because it's very, very safe that way. And because of that, we do preoperative appointments. And why I say that is because we get with their physicians if they have any kind of medical complications. And, there are a lot of times that we work with the physicians to alter their medications for the surgery. And that's really important. We would not want to go in and do a surgery blindly without knowing all their health history and things that might affect things while we're working on them. But, I think there are even studies out there now that show that it's even safer using IV sedation than nothing at all.
You're big on sedation.
Right? we love sedation.
I mean, you were like an early adopter.
We've been doing
like
it.
in the old days. I mean,
we've been doing it 20 years, yeah.
Now, at the top of the show, I said you guys are the go-to implant center in Kentucky. And I asked you in the green room, I said, are there a lot of guys doing it where the way you're doing it within like 30 miles or 100 miles? And I think you said not really.
Not really, not within that distance. Now, there might be people, 2-3 hours away in bigger cities. I know Nashville, it's close, and I know they do it down there. But, people hate to go to Nashville, have this done, because typically, again, you're going to more than one dentist if you go down there to have it done. And, we do it all right there in our office, and that makes a big difference. Plus, it's close to home for a lot of it.
Now, you told me this, that how it's typically done, correct me if I'm wrong, is you go to one place where you do the surgery, one office. Then you go to another office where they put the teeth on top, and a third office to get them maintained.
Right.
So you do all 3 parts.
Absolutely.
And then also cuts cost?
Cuts costs, cuts
time. Like one doctor, one fee.
Yeah, and establishes rapport. We like to get to know our patients. They like to get to know us. And if you're going back and forth between dental offices, it's kind of hard to do. And many times they just say, oh, I'm so glad I found somebody that could do it all under one place. And that's why they end up coming to us many times, is just because they know we do it all at our office. We do everything. So,
is that right?
Yeah.
Okay, good. Now, you brought photos. Let's take a look at some of these photos. And these are all people that, let me get this straight. So the photos you're showing me, their option was a denture, and now they have new upper lower teeth that don't come out.
Exactly.
Okay,
yes,
let's take a look.
And these are actual patients. Here's a young lady. Love her. Very pleasant young lady. Smiley, you can tell she's a happy person anyway. She'd always wanted a pretty smile, and she had bad teeth and bleeding gums. Randy, I'd really like for you to look at her picture. And she loved to smile. She did not like her smile. You can look at her gums.
What's going on there?
They were very puffy. They were bleeding and infected. She had bad teeth. She had
so is that like gum disease kind of a thing?
It is gum disease, but it is an infection. And so it's just, everybody understands what infection is.
So brushing and flossing won't work?
Yes, at that point, it's beyond brushing and flossing. She was going to lose her teeth, and she was afraid she was going to get a denture. And we were very happy to tell her that she did not have to get a denture, that we could put teeth in there that would not come out, and they were supported by dental implants.
Now, when you're on a consult with somebody like this, and you've been doing it a long time, do you ever get like, they're telling you their hard luck story, but do you ever get excited going, boy, this is going to be good? They don't even know how good this is going to be.
I knew she was going to be a really good result, just because.
Can you see it, like in your head?
Oh,
going,
yeah.
I know.
For one like this, I can absolutely tell there's going to be, a huge.
Let's take a look. Is that her? Oh, boy.
Right. So now
Oh,
she's
yeah.
still the same smiling, happy lady, but she's really proud of her smile now. So my guess is that she smiles even more now than she used to. So, but we got rid of all the infected gums. We got rid of the bad teeth. And we've got a lady who's really proud of her smile. Okay, so I would like for you to look at these pictures side by side and notice some of the differences. In the after, you can tell just by the way we designed the teeth, with the technology we have today. If you look at the teeth, they perfectly follow her lower lip line, which really accentuates her face.
You do that on a computer in a way? Or?
Yes, we do. We do the design by computer.
Okay.
And,
That's
which is new from the last time I was here. We have so much more new technology with the CT scans, with the digital impressions, the design phase with the computers and printers and things like that. So, anyway, if you look at that, and look at those pictures and tell me, do you think she looks more confident now?
That's for sure.
She might look
even more sophisticated.
More sophisticated. She might, people might perceive her as more educated now. Not that she wasn't before, but
That's
just
interesting.
looking at her smile. But just the newer self-confidence, and like I say, she used to smile anyway, but now she just really is exuberant, and I think that it promotes a really feeling of self-confidence, which makes a big change in her personality and the way people perceive her.
And you've told me it's like a smile makes you look more attractive.
Yeah,
but that's everybody.
So. That's
right?
everybody.
Because it's obvious on this one.
That's everybody. Okay, I'd like for you to take a look at this next guy.
Okay.
He's a very recent patient, and he came to us, and he had been fearful of the dentist forever. He knew that he had a bad situation. He knew he was going to lose his teeth.
Okay.
But he was so afraid that he was going to end up in a denture. And so he had avoided it for a few years, he said. And so anyway, we discussed his options. We discussed that he would not have to have a denture.
Okay.
We discussed that, we discussed his fear of pain. There'd be very little pain. And so, he decided he was going to go through with it. And he's smiling in that picture, but typically when he came to the office, he kind of hid his smile. He was not proud of the way his teeth looked. And so anyway,
did it give the impression like he was a serious guy?
He did.
Or grumpy maybe, or even a tough guy?
Yeah, maybe grumpy, maybe just, or serious. I don't want to. I don't want to pin something on him that he wasn't, but he just didn't seem as happy as he does in his final picture.
Let's take a look at that.
And so now he smiles all the time.
Very nice.
And he's really proud of his teeth, and he's really glad that he went through it. And now he's got teeth. He does not have a denture. They're in his mouth. They don't come out. They're supported by dental implants, and he's just a very happy camper.
When you say they have to learn to smile again, what do you mean by that?
For so many years, people that don't like their smile originally, they have a tendency to hide their smile. They don't like to smile because they don't like to show it, because either one, they don't think it looks good, or they're ashamed of it, or whatever. So when they get their new smile, you think that they would go out there just right away, and some people do. They'll go out there and just smile all the time. But some people, they've guarded their smile for so long, it takes them a while to learn how to smile again.
Takes a few compliments, maybe?
It does, and then people that have known them forever, they'll kind of say, they'll mention the fact that, hey, I like your smile, or or they'll tell their spouse, say, he looks happy today, or whatever. But after they hear a few of those, then gradually you'll just notice a change, that they start smiling all the time.
He looks more handsome for sure.
Yeah, and I think he looks younger. I mean, what do you think about that?
Yeah, I agree with that.
Yeah, and he's just such a nice fella, and I think his final results allows him to kind of project that image that, he is a happy guy.
What's it like? Like you're in the office, they're seeing their teeth in the mirror for the first time. What's that like for some people?
For some people, it's pretty emotional. They've waited for it for many years, and the fact that we can give them something that they're proud of, and actually something that's not going to come in and out, it's usually pretty emotional. They're pretty excited. Yeah. Of course, the day of, they're usually sedated, so it's usually on the post-op.
Yeah, okay,
Yeah,
okay.
Yeah. So,
okay. Time for a few more.
Okay, well, let's take a look. Here's the lady. Let me give you her before. Just a really nice lady from a few towns away. Again, she'd always wanted a pretty smile, and she'd always put her kids first. So she came last, but once the kids were out of the house and everything, I think her husband encouraged her to go forward with getting the smile that she'd always wanted. And she was a very nice lady.
Like she was going to end up in a denture?
She was going to end up in a denture on the top. She sure was.
Okay.
And so that might be one reason why she avoided it, but she said it's because she always put her kids first, and she kind of let her teeth go. And so now it was her time. And so she decided to go through, because she didn't want a denture. She wanted something that was going to be fixed so she could eat better.
When you say fixed, meaning a set of teeth that don't come out.
Yeah, that's exactly right. Yeah, yes, it's exactly right.
Let's take a look at that after.
And again, she's pretty, she's pretty there, but she's I don't know.
Wow.
I just think it just really promotes how much happier she seems. It's just an image thing. It's a self-confidence thing.
I mean, with teeth like this, can you bite into like a carrot with your front teeth, or you got to be careful with those front teeth?
No, with the new teeth, you can bite into anything that
whatever you want.
Whatever you want, and you can bite into apples. A lot of people, they really miss salads. A lot of people miss
salads.
Salads.
That's tough for them to eat.
It's tough for them to eat
when you have bad teeth.
When they have bad teeth, and a lot of people, one thing we hear is eating pizza, because typically pizza is kind of chewy.
Okay.
And they're afraid if their teeth are bad or sore or loose or whatever, some people will come in and they're afraid that if they bite into something like that, they're going to lose a tooth. And then you have a whole other problem. Then you have an emergency.
Now is this true that many people come in hopeless, meaning without hope?
Exactly.
Like they almost don't think anything can be done.
Right.
Like maybe they've seen you on TV or their friend had it done, and they come in like, Doc, are you sure I could do this? Does that ever happen where they're skeptical?
We get a lot of very skeptical people. One, because they just think that they're worse than anybody else we've ever seen, and they just don't think we have the ability to help them.
Okay.
So we're able to educate them and explain to them that we can. And another thing is why they're skeptical, because the dentist that they've been going to before tell them that they don't have enough bone for implants. And so they've been told that they can't have implants with teeth that don't come in and don't come out.
Okay.
And so they come to us thinking that there is no hope because a professional has told them that they don't have hope.
Okay.
Yeah.
Now, do you draw from other states, or like from an hour away, 2 hours away?
We have patients 2 or 3 hours away. Yeah.
Is that right?
Yeah.
Because not a lot of guys doing what you're doing.
That's right. And some of the bigger cities, but a lot of these people are in communities like ours, and they don't want to go to the bigger cities. They like the small town feel, and the fact that they can find out that we can do everything in our office, and they don't have to go to the big city to get that treatment done. They come from a long way away.
That's nice.
Yeah.
That's nice.
Yeah. Okay, let me show you this next patient.
All right.
She's one of our favorites. She came in.
Now you keep saying these are one of your favorites.
Well, all the ones we have are our favorites. We didn't bring any that weren't our favorites. How's that? It's hard to talk about people that aren't your favorites, but she was definitely one of our favorites.
All right.
All right. Very, very, very nice lady. Very spiritual lady. Very church-going lady. And she had lost her husband, okay? And I don't know how long ago she had lost her husband, but she was alone, and she realized she wanted a better smile and better teeth. And I think she knew in the back of her head that she was going to lose her teeth, and she did not want a denture. And so when she came in, we talked to her, and when we told her that she wouldn't have to have a denture, she was very, very happy. And so anyway, I'm gonna show you this after, and I just love it. She even had her hair done for this one. Just
it's very nice.
And it
looks natural.
Yeah.
Again, I'm not trying to side with you, but I think anybody looking at this,
well, and so
those don't look like denture teeth or fake teeth.
No, they look natural, very natural, especially it fits her face. But the best part is she tells the ladies that work in my office all the time, she goes, Dr. Jackson told me, said if I got new teeth that I was going to find a boyfriend, and I did. And so she tells everybody in our office because I told her she would find a new boyfriend, and she did because she got new teeth.
So they're like charisma comes back, their enthusiasm for life comes back.
Yeah,
I mean,
she's just
is
more
it one of those
outgoing.
things?
Yeah, and she's a very church-going lady. She contributes a lot to the church. She spends a lot of time at the church, so it wasn't like she didn't participate in activities, but now she's just more outgoing and just a very happy lady.
Now, do they ever say, Dr. Jackson, you changed my life? Do you hear that?
We do hear that, and initially we used to think, well, that's nice, but the more we thought about it, we didn't change their life. They changed their life. They allowed us to kind of help do some stuff where they could change their life, but they're the ones that change their own lives. So
that's good.
They're the ones that need to get the credit for changing their life. So
like making that first call or appointment.
Right. So when they say we changed their lives,
they did.
It's all them. We just kind of helped them along the way. So
dental insurance. I got to ask you about dental insurance because I guess the max payout's only a couple grand, $1,000. Medicare, Medicaid doesn't really cover this.
Right.
But you say people are financing this. Is that right?
Yeah, dental insurance. That's a whole other issue. But dental insurance does not cover implants.
Okay.
And I'll just say that up front. It might cover partial of one implant, but let's get off that. Let's go to how they can afford it. Some people are fortunate and have the means to do it. Okay. But so many people don't, and so now there are a lot of financing companies that help finance this type of treatment.
Is that right?
Finance implants and teeth that are in and don't come out, and so we're able to help a lot of people just because now it's so prevalent that there are a lot of finance companies.
Couldn't they get co-signers?
They do sometimes. Yeah,
Okay.
A lot of times it's a relative. Okay, let me show you this next patient.
All right.
And I won't say this is one of my favorite ones.
But it is.
But she is.
Okay.
Actually, she was one of our very first patients, and that's why she's one of our favorite ones.
Okay.
And very nice lady. She did come from another state, but she had family that lived in town. And so I think her kids had heard about us and knew that she was going to have to lose her teeth. And she knew she didn't want a denture, and so their kids brought her up to our office in Bowling Green, and so we were able to provide the treatment that we like to, that we're talking about. And here,
so her option would have been a denture.
Would have been a denture.
So she has upper and lower teeth that don't come out now.
That's right.
Let's take a look at that.
Right. And she still comes in on a regular basis, although she lives in a different state. She comes up to visit family, and so we're still able to see her on a regular basis. And like I say, this is one of our first patients, so she's had these for several years now. And so she really likes them, and they're doing great.
I don't want to rush you, but we're very short on time, probably a couple minutes left. And I know you still have a lot more photos.
I do.
So let me rush you through those a little bit.
I do. I have a lot of favorites, but I've got to show you this one.
Okay.
Because some people, might be skeptical that how much an appearance might change. This is a perfect example. Here's a very, very nice young lady. She knew she was going to lose her teeth. She had bleeding teeth, or bleeding gums and bad teeth, bad breath. She had all the things, and that's what she expressed to us.
Okay.
And she wanted to get rid of that. And she'd been, in a bad situation for a while now, and she just needed a new start in her life. And so,
did you get excited when you saw her? Like, are you thinking this is going to be good?
I knew we could help her a lot, but I had no idea how it was going to affect her life and her personality.
Okay.
And it was just way beyond anything I could have even guessed. Let me just show her.
That's her.
This is just such a difference. And she is a young lady, and she's got the best personality in the world.
Wow.
She comes in the office now, and she dances around, and she's bubbly, and she's just.
Now that is an extreme smile makeover.
And I realize she doesn't have makeup on in the first one, and she does here, but you can just tell that it's made a huge difference in her appearance. And like I said, I would have not had any idea how it would have changed her personality. She is so outgoing and exuberant now. It's just fun when she.
I mean,
comes
you
out.
wouldn't even know those are the same people. By the
You
way.
would not, and
Well, she's got
people watching this on TV might not believe it's the same person, but it is. I promise. So.
And it just happens in one day when they get
one
it
day.
on that day.
Right. She was so excited. Yeah.
Now, I guess they have multiple options. There's the snap in, snap out teeth, right? Snap out dentures.
Right.
And then there's teeth that don't come in and out.
Right.
You're not a fan of these snap in dentures because they are popular, right?
Yes, they're very popular. And I have to say, we've done many of them over the years. But once we learned to place them in where they don't come in and don't come out, it's just a game changer. So we still do them. But you have to realize they're still a denture, okay, because they're going to come in. They're
But
going to
you
come
urge
out.
people to get the teeth that don't come out.
Oh, absolutely. Yeah.
Okay. It's a little bit more.
It's more. It's a little bit more, but it's the difference in night and day as far as function, and just the confidence that you have with teeth that don't come in and don't come out, as opposed to a denture.
Are you one of the most experienced guys in your town?
Oh, absolutely.
For sure.
Yeah, I've been doing it for a long time, and I'm one of the older guys, so also have a lot more experience than everybody else in town.
Do you feel like you're at the top of your game when it comes to this?
I do.
Like you could pretty much handle anything that walks to that door? You feel that way?
Absolutely.
Yeah. Because they think they're the worst, you told me. Everybody thinks they're the worst.
Everybody thinks it's the worst case I've ever seen, and I have to promise them that they're not. But
do you smile when they say that? Doc, this is the worst you've ever seen.
I laugh, but then I say, okay, let's take a look.
Okay.
And then I'm like, convince them that no, we've seen worse.
So no more dentures.
No more dentures.
Final message, we're out of time. Somebody watching this, they've heard what you have to say. Maybe they've seen you on TV before. In fact, I think you told me many of these people have seen you on TV, and they put it off and put it off. So what do you say to them? They're still skeptical.
I say, please call the office. Let us get you in there and let us take a look and
at least get a
evaluate them.
consult.
At least get a consult. We don't even charge for a consult, and so let us see what we can do. I mean, I promise you, we can help you. So
now you told me that sometimes the wives, because their husbands are complaining about their teeth so much, that they have to make the appointment for the husband. Does that happen?
It happens all the time. The wives are usually the ones that call. The men are pretty stubborn.
They drag them in.
They drag them in, and
and then he changes his mind after it's all done.
Well, once it's all done, he's like, yeah, he knows he's had bad teeth, so he knows he's got to get something done. He doesn't want a denture. That's been a big fear. And so he just says, oh, I don't care what they look like. I just want to be able to eat and not have any pain. And then once we get it all done and they start getting compliments about their smile and stuff, then they kind of change their tune. They're really glad that they have a new smile to go along with being able to eat better.
Now you do the IV sedation. Typically only a specialist is trained in the IV sedation.
Well,
but you do that there.
Yeah, we do it right here. Yeah,
Nice.
we made special effort to go get the extra training to do it safely. We monitor everything. We monitor their heart rate, their breathing, their blood pressure. So it's all done very safely. And like I said earlier, if they have any kind of medical conditions or take any medicines, we make sure that we work with their physicians to do whatever, and we just want to keep it as safe as possible.
Well, Dr. Jackson, always a pleasure having you on the program. Good stuff. If they want to make an appointment, call your office or go to the website and make an appointment. What do you prefer?
Call the office. The website can give you a lot of good info.
And they still could see you.
Yes.
They see you on the consult if they ask for you?
Yeah, they just have to say they need to see Dr. Jackson.
All right. Thanks again. Okay. Good stuff.
Thank you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.